Good morning, everyone. Caps Academy. Uh, what the July 2025 cohort? Woo! So when you email us in like a year from now, please remind us what cohort. Because I always like, hey, we heard from this person. Oh my goodness. Anyway, good morning, my Renee Ariano, Caps Academy instructor. So beautiful to see all your faces this morning. Woke up a little bit of anxiety. I talked to Carlos, checked in this morning, and see your faces. So it makes me really, really happy. And I know I've spoken with some of you that makes me helps me with my anxiety to see you smile at me. Okay. So thank you. All right. So this is one of my favorite presentations. Actually, a lot of them are my favorite. But this is we're going to be going over the role of consumers and families. And I really go into, oh, absolutely, Carlos. I will get into the history of the peer movement. And I get so flippin' excited. You'll see why. So we jump into an activity right away with that. And then we're going to get into really parent partners. We're going to think about like, take a look at angle from the family view, man. And I know there's some of us that shared our stories that we have family members, but it's like, I know for my journey, it's like, my family, yeah, whatever, but what they had to go through. I do remember once needing help. My mom didn't know what the hell to do. She had me sleep with her next to her in the bed, like for a week, you know what I mean? So no, not knowing what to do about it. Okay. So I think that's a big key. All right. So here, let me share my screen. I'd really like to make my slides and my presentations really fun for you. So I hope you enjoy them.
Renee, do you need me to share the gathering guidelines, or are you going to do that?
Yes, please, Carlos. Thank you so much. And welcome, Carlos, back. He took a day off yesterday, Mr. Carlos. I hope you don't mind me saying that. Talking about self-care. All right. All right. Can we have, how do you like to do the waterfall, Carlos? Do you mind taking this one?
All right, y'all, good morning. Y'all know the drill. So I'll read what's in bold, and then it's a different person reads the letter. So here we go. Show up and be present. Let's start it off, please.
Notice yourself, what you are thinking and feeling.
Pay deep attention to what is happening within you and around you.
Extend honor and respect by being visible.
Empower, inspire others by role modeling.
Thank you. Gracias. Next section. Pay attention to what is heart and meaning. Go.
Listen from the heart with an appreciation from one another.
Speak one at a time. Honor and value who is speaking.
Please refrain from giving each other feedback unless it's requested, if you ask permission, or it's explicitly part of the process.
Pay attention to your attention. Notice that you are thinking when your mind wanders and what you do to bring yourself back.
Thank you. Next section. Tell your truth without blame or judgment. Go.
Speak from the heart.
Ask for clarification when needed.
Ask for what you need or want.
Choosing silence at any time is fine. Deal with what's so as it happens. When something happens that impacts the whole, bring it forward to the group.
Keep yourself safe, whatever that means for you. Take breaks as needed.
Thank you. Last section. Be open and unattached to outcomes. Go.
Trust the process.
If emotions are activated, please allow each person to have their experience. If tears come, let the person have them. Please don't attempt to calm, just listen.
Thank you all. Additionally, we request that you make a commitment to confidentiality. Whatever is said in this room stays in this room. Show of hands, please, either physically or virtually. Thank you, thank you, thank you. I'm just doing my due diligence here. 1 screen, 2 screens. Excellent. You can put your hands down. Thank you. Lastly, please honor one another and this process by keeping time agreements, especially start and end on breaks. Thank you so much. Back to you, Renee.
Right on. Thank you, thank you, thank you. All right. Back to the role of consumers and families. All right, here we go. Get to see the faces. All right, there we go. Today, I say a brief history of the peer movement. We're going to why is peer support? What is peer support for family? We're going to do a really great activity called Peer Role or Not, and why now? Why now? Why integrate peers now into the workforce? So here we go. I'll slow down, Carlos. Whenever you're ready, we're going to jump into the history of the peer movement. And I hope you were able to take a look at the class activity. I'm going to throw it in the chat, and this is what it's going to look like. If you check this baby out, we have 21 events on here. Okay. Julia, gosh, I love your frames. You make me want to go get out bright colored frames. What's the date on the first one? Will you talk about that first one right there? Will you read that for me?
Read the date.
The first one, number 1.
1868, Elizabeth Packard.
Okay, can you read number 21 now on the bottom right?
No, I cannot see 21 on the bottom
Oh,
right.
I'm sorry. Is it just,
There we go.
is it too- okay,
2020, SB 803, peer certification.
Woo-hoo! So 2020 SB Senate Bill 803 peer certification. That is us here in the house. Okay. Now tell me the date again on number 1.
1868.
Oh, baby, I got the chills right now. Do you not see that? We are number 21 on this timeline. 1868. Here we are, 2020. I got the chills. We're trailblazers right now. You know, I was having a conversation with them as well. Man, if we're doing this stuff and it could really change the world later, holy crap, right? Okay. Woo, I love this. Okay, so we're going to get into this. What we're going to do, let's see, did I do my slide? Okay, then I get into some cool videos, okay? So here we go. I'm going to drop this into the chat. Welcome back, Joshua. Hold on. Okay, here I'm dropping in the chat. So here's a timeline, okay, of the history of the peer movement. And how we're going to break it down is like this. Okay, we're going to have 7 rooms. There we go.
How much time do you need, Renee?
Oh, yeah. Let's see. Oh, man. Did I have it on there? I think we do 15 minutes.
That's good. Thank you.
I think it's 15 minutes. Okay. So room 1, you're going to research 1 through 3. Do you see that? So you'll be doing 1868 Elizabeth Packard, journalist Nellie Bly, and then 1909 Clifford Beers. Okay. Room 2, you're going to research 4 through 6. Okay. And down. Room 3, you're going to research 7 through 9. Okay. On that timeline. Now, what you're going to do, what I want you to do is you're going to go in there and each of you are going to break it down within your group. You're going to research that significant event or person and give us the juice, baby. Give us the main nugget of why are they on this damn timeline? You know, and like, you know how we do book reports and we're like, no, give us the hoogle, give us the real, the golden shiny nugget, you know, so this is really good, interesting. And I'll give you a little breakdown of it at the end, but I just love to see what you all come up with. And I don't know, it's just always nice to see someone come in and just blow my mind with what they bring to the table. Cause some of these are not so, you know, exciting, but they are very, very important. Okay, so do we understand what we're going to do? And Carlos, whenever you're ready for those breakout rooms.
Sounds good. We're good to go?
Yeah, okay.
All right.
So everyone understand? Okay, research your events on the timeline by your room. It'll tell you. We'll go by. We'll go. Thank you. No, I didn't specify for someone to come out and like be a report person, but I hope we all got the gist of it and had a good time. Let's start out with the breakout rooms. Let's do 1. Okay, am I sharing my screen? I want to share my timeline really quick here. Yeah. All right. So
I don't think I did a very good job. I thought I was prepared for this because I did a lot of cutting and pasting last night, to be honest. But
I'm sure you did. I'm sure you did.
I know. No.
What room are you in? Which one did? Let me call on.
I'm
the
sorry.
First. Oh no, you're good.
I thought you had called on us because some of my people were on the screen. Let me mute.
No worries. Okay, so I have room 1, Carlos, Feliciano, Jonathan, Christopher, Yolanda. You had 1 through 3, Elizabeth Packard, journalist Nellie Bly, and Clifford Beers. What do you have for us?
Yeah, so I'll start off with Elizabeth Packard. Let me just move my notepad over a little bit better. Sorry about that. Okay, so falsely institutionalized for disagreeing with her husband's views on religion. She laid the groundwork for patients' rights, particularly women's patients' rights in institutionalized settings. Elizabeth advocated for due process for people entering asylums. She was part of the Packard versus Packard court case, which is her and her husband, where she successfully sued her husband for being committed, but she was legally sane and was given precedence for self-agency. And then we have Nellie Bly. She was a pioneering female investigative journalist who exposed the mental health agencies for inhumane treatment, excuse me. She went undercover in the Blackwell Island Asylum in New York, working for Joseph Pulitzer's New York World magazine, and her work helped for funds for reforming mental health institutions. And she wrote the article series that's called 10 Days in the Madhouse, and this was in 1887, where she exposed inhumane treatment again at the Blackwell Island Asylum in New York. And
Wait,
then
really quick, I'm sorry to interrupt, but what year was that?
1887 is what we had.
Holy mackerel.
Yeah.
Okay, keep going.
Yeah, and let's see. So Clifford W. Beers, he was a Yale graduate who experienced abuse and neglect while hospitalized, and he was hospitalized from 1900 to 1903 for bipolar disorder, and left the institution in actually 1905. And then he completed a book about his experiences called A Mind That Found Itself, and that was published in 1908. And he introduced the idea that mental health conditions can be treated as opposed to a permanent, irreparable condition. And he helped launch the mental health reform movement in the United States.
Thank you. And that was 1868. Elizabeth Packard, a woman in 1868.
We miss Nellie.
Nellie. I think she was the journalist, right?
Yes.
Yeah, the journalist. Yeah, and there's if you get to watch the movies on this, is like, holy cow. Victor, Feliciano, I see you shaking your heads. Oh my goodness. Clifford Beers. Woo. Thank you. All right. Thank you so much. Great report. How many of you is the first time hearing this? Ooh, yes, I love it. Feeding your minds. Yes. Room 2. Let's see. You had we have Kurt, Miriam, Naomi, Shawnee, Stephanie, Italian. You had 4 through 6. So you had the insulin coma therapy, 1930, 1940, We're Not Alone, and 1950, widespread use of lobotomy and shock treatment therapy.
Yeah. So, hi, good morning, everyone. I'm gonna just real quick, I'm gonna touch on the insulin coma therapy and We Are Not Alone. And Shawnee is gonna go ahead and take us home with the lobotomy and shock therapy. We got the fun stuff, I'll tell you. So, starting off with 1930, insulin coma therapy. It's also known as insulin shock therapy. It was controversial treatment for schizophrenia and other mental illnesses. It basically involves administering large doses of insulin to induce a hypoglycemic coma, which was then reversed with glucose. So what it is basically daily injections of insulin that gradually increase the dose until they entered a coma. The process was like repeated multiple times, sometimes for weeks and even months. The theory on why it was used is that the theory was that the induced coma and subsequent recovery would somehow reset the brain and alleviate symptoms of mental illness. It was particularly popular for treating schizophrenia. But the issue and the problems with doing the insulin coma therapy was that it was potentially fatal and it was very dangerous. It had significant risks, including seizures, brain damage, and death. It was not an effective treatment. It did not cure schizophrenia or other mental illnesses, and its effects were often just temporary. It was super unpleasant and traumatic. Yeah, so it didn't work out, but it was quite painful. nonetheless. And that's for the insulin coma therapy. 1940s, We Are Not Alone is really cool. What it was a self-help group formed by former psychiatric patients at Rockland State Hospital in New York. They basically aim to support each other in transitioning from the hospital back into the community. This group also eventually led to the establishment of a place called Fountain House, which was a model for psychosocial rehabilitation. They actually said that Fountain House became a model for similar facilities worldwide. And the purpose of the group was their primary goal was to provide support and guidance to others navigating the challenging transition from psychiatric hospitalization to community living. So I thought that was really, really cool. I'm gonna send it on over
that
to
was
Shawnee.
so good. Thank you so much. That was so good. Fountain House. We were talking about psych rehab. That was like basically how the Village in Long Beach was like, the foundation of that. Thank you. Keep on going. And look at 1930 insulin coma. They were doing this 1930. Okay. 1940. Okay. Keep going.
The disturbing lobotomy craze in the
Ooh.
1950s. It was not medicine. It was a systemic psychological mutilations disguised as healing. A state-sanctioned neurological assault carried under the disguise of medicine, where thousands of vulnerable people, many of them women, children, and mentally ill, were deliberately, I said deliberately, brain damaged by doctors using cruel tools like ice picks to silence behavior deemed inconvenient, often without consent, leaving victims emotionally dead, cognitively broken, or permanently erased, while society applaud the destruction as treatment.
Thank you. And that was in 1950s?
Yes.
Thank you so much. That was really powerful. Even your presentation of it was really good. Thank you. Room 3. All right, anybody, you still hear some more new stuff? More information? Yes. Keep it going. Room 3. We did 7 through 9. 1970s, Howie the Heart. 63, Community Health Act. And 1975, Supreme Court ruling O'Connor versus Donaldson. What do you got?
I'll be our representative for the day. I apologize. I think we got a little confused. We thought we just had to report on one, but I did do some quick research to cap all 3 of them off. So we should be good. 1970s, Howie the Heart. Seems like an actually really cool dude. You guys should look this guy up. He was the first consumer-run, peer-led organization in the country. So he basically started the peer movement in the United States, for what it sounds like. He was innovated the early drop-off centers staffed by peers. So it was no longer just going and seeing nurses and doctors. You were talking to people that are like you. And essentially his whole career was, he was an advocate for the homeless and people in poverty. So that was his big kind of claim to fame and what he's kind of known for. And then the 1963 Community Mental Health Act. It was an act to provide federal funding for community mental health centers and research facilities in the United States. It led to considerable deinstitutionalization. So that was the first step into essentially taking people out of mental hospitals that didn't need to be there. They just didn't have the knowledge, essentially, it sounds like, to treat these people on the outside. They just felt it was better to keep them locked up than let them out in the world and have to deal with them that way. And then the 1975 court ruling of O'Connor versus Donaldson, it basically says that the state can not constitutionally confine a non-dangerous individual who is capable of surviving safely in freedom by themselves or with the help and willing of responsible family members and friends. So essentially it was taking them out and kind of placing them in the care of their family and friends who would say, yeah, we can watch them. We can take care of them. If they start showing signs, we can bring them back. We can do everything that you guys were doing inside, but we can do it outside and keep them having a happier, more healthier life.
But also the super important part of this particular thing is that people weren't being confined against their will for actual or perceived nonviolent mental illnesses.
Right. Right. And that was in 1975, y'all. 75. It's like, where are we going? Backwards, upwards, upwards. Thank you for hitting on. Thank you so much, Matthew. That was great. Thank you, room 3. Was that 3 or 4? 3. All right. So now we have 10. 1978 on our own. 1978 because it can Community Residential System Act. Let's see. Am I right? And then 12 First Annual Alternatives Conference. Room 4. We had Julia, Nathan, Ruth, Victor, and Vivian.
Do I start?
Sure. Hello.
I did. I only did mine on the 1 because I didn't know we were supposed to do all 3.
That's okay. That's okay. Good morning.
Good morning. I did the Judy Chamberlain, and I wrote down just a little bit of stuff. She activated for the women's movement, the gay, and fought for human rights. That's what it says, and it advocated for civil rights of mental patients.
Right on. Thank you.
She was
Anyone else?
also a victim of hospitalization and dehumanizing through her treatment. She was a key person to start changing labels from and calling ex-patients versus patients of trouble. In psychiatric wards back then, forced into drugs, surgery, shock, created a lot of movement for women, a lot of movement for the change of mental health. And until she died in 2010. Her legacy continues, and that pretty much, like they say, paved the yellow brick road for better mental health.
Yes, I love it. Thank you.
We also did talk about the 1978 Community Residential Treatment Systems Act. Essentially what it did, funded the development of residential treatment programs, group homes, halfway houses, and other supervised living facilities, encouraged states to create networks of non-institutional, locally based mental health services, and aimed to ensure that individuals can receive care in the least restrictive environment possible.
Right on. Thank you. Ooh. Are we all getting bored yet? No, nobody's falling asleep yet. Good. Yes, I love it. Thank you. And I love when you bring the spicy to this, because it was like some people, this is bringing the spicy. This is good to know. We're on this timeline. All right. Thank you. Now we got room 5. We have 13 through 15. So the ADA, super important, Olmstead Act, and then Jean Campbell. Brandon, Desiree, Isabel, Julia, Sweet, Carla, Carrie.
Good morning.
Sorry. There we go. Hi.
13. Okay, I'll start with 13 and then we can go from there. Perfect. Good morning, everyone. The ADA in 1990 that was signed into law is particularly significant in legitimizing peer support as a professional role in protecting the rights of those who provide those services based on their lived experience with disabilities. Specifically, employment protection under Title I, also reasonable accommodations, confidentiality protections, and professional development.
Right on. Thank you. Right.
The Olmstead Act of, what is it, 1999. It was a Supreme Court case, Olmstead versus LC, that established the unjustified segregation of individuals with disabilities that constitutes discrimination under the Americans with Disabilities Act, and the landmark decision affirmed that individuals with disabilities have the right to live in the community rather than being institutionalized, promoting integration and independence.
I love that. Thank you. Yeah. Want to know about the ADA and the Olmstead Act, okay? All right. And what do you have for Jean Campbell? Great job.
I'll go.
Thank you.
So Jean Campbell is a managing director at Missouri Institute of Mental Health. Her skills and expertise are health service research, mental health, consumer studies, positive psychology, healthcare management, psychopathology, health disparities, health outcomes, and healthcare delivery. and she did a study. It was a federally funded national effort to study the effectiveness of consumer-operated programs as an adjunct to traditional mental health services in improving the outcomes of adults with serious mental illness.
Right on. Thank you.
Can I ask you a question, Renee?
Absolutely.
I accidentally went into her LinkedIn when I was looking
Oh,
her up.
yeah. Go for
Is
it.
she a
Really?
TED Talk speaker? Because it said she was a TED Talk speaker.
Oh, yes, yes, absolutely. And then also you saw one, Pat Deegan, you saw TED Talk too on, is a really big one. But yes, thank you for that. Do you have a link at all if you want to throw in the chat for us? Do you have one on her?
Oh, I just have it up. I don't know how to do all
Oh,
that.
no, it's okay. I'll look it up. I'm always interested as I geek out on some stuff. Thank you. Oh, I love you all. Oh, this is good stuff. All right, we're good. Great work, room 5. All right, room 6, 16 through 18, Robert Whitaker. The 2020 or 2003 New President's New Freedom Commission on Health. And then the 18 is Mental Health Services Prop 63. What do you got?
Oscar, I think
Yep.
we're gonna go, but we
Yep.
also did one. But I want to mention the other two before he does 16 because we
Sure.
worked together.
Okay.
So, which 16, Robert Whitaker. So he was an author who was also an investigative journalist, and he wrote a lot on psychiatry, the mental health treatment, and especially the pharmaceutical industry. The Mad in America from 2002, basically he examined how people with serious mental health issues, especially schizophrenia, were being treated like in the institution. And so it sparked conversation, right? Because he was bringing awareness to that. He didn't think that was good, obviously. And so because he was a journalist, he went ahead and wrote another book as well, how it posed a question that if the intake of pharmaceutical drugs is getting higher, why is it that the mental health issue is also still rising? And why is it that people are still addicted and still using drugs and are still, dealing with mental health issues? So that was a big question as well. And so also I did want to know, Mad in America touched a lot about on what Taylor was talking about on how the schizophrenic people. So we're moving forward, right? Because I noticed that as we go down the years, we're progressing. And so also the which one are we on? 17, the President's New Freedom Commission on Mental Health. That one was also a goal to improve access to quality mental health, and so that no American is left behind. They basically found out that the system was fragmented and difficult to navigate. It focused more on crisis management than prevention or recovery. And so they were failing to use evidence-based practices effectively and lacking in coordination across systems like schools, justice, housing, and healthcare. Basically, they were figuring out that everything was connected and everything was basically not up to par. So moving forward, I leave the space open for Oscar.
Drop the mic.
Okay.
Thank you.
Yeah, okay, we did 18, 2004 Mental Health Services Act, which is also known as MHSA, Prop 63. So we said it was passed in 2004, and it was aimed to increase funding, shift focus from reduce stigma and challenge oversight. Well, we have many components. It was family and client driven. It was oriented to recovery. It was meant to create money for it to be accessible, culturally competent. And one of the things that's very important, it was supposed to have accountability. So we see the money being distributed in community services, prevention and early intervention, innovation, technology, and workforce education and training. Most recently, that 2004 Act was rebumped with Prop One, the BHSA, the Behavioral Health Services Act of 2024, which means was last year. It reformed MHSA, broadened the scope of services to include substance use disorders, with the emphasis on housing, enhanced oversight, and accountability. I do have a comment about that. There's a lot of criticism. There's a lot of criticism about the lack of accountability in the outcomes of the measurements. It is difficult to prove the effectiveness of where the money is being spent and what services are working and what is not. It has weak oversight. It has weak fiscal accountability, and some counties have even been accused of diverting funds. We talked a little bit about the problems, and we gave an example. Many programs have these work readiness programs or services in their, portfolio. Unfortunately, it's all referral services, but no work training and no work readiness. So that's a big waste of money in many of the services that we have. So this criticism, there's great things happening. I think these peer support trainings enjoys the funding, the benefits of the funding from this act, but there's many other services that do waste a lot of money with nothing to prove. And that's about it.
Booyah. Thank you for that. Wow, that was really, really good. Thank you for the update on that too, Oscar.
Oh, yes.
I appreciate that. Woo, on fire. All right. Thank you. Room 6. 16 through. Oh, no. Wait, that's you just all did that. Okay, room 7. Angelina, all right, you're up. Hillary,
All
Janet,
right.
Rudy, Shiva. We had 19 to 21. Let's hear it.
We talked a little bit, so it took a while to kind of get into it more, but okay, CAMHPRO, California Association of Mental Health Peer-Run Organizations. It's a nonprofit organization in California. It's focused on promoting the voice, influence, and leadership of people with lived experience of mental health challenges. Their mission is to strengthen the capacity of peer-run organizations and to advocate for systems change by empowering people with lived experience of mental health challenges, by peer empowerment, by advocacy, by capacity building, meaning the technical part, assisting training and support peer-run organizations in that area, education and outreach, hosting events and forums. And so that's as much as I got into it.
That was really good. Thank you.
Thank you.
Uh-huh.
All right, I've got the book Lost Connections by Johan Hari. He identifies 9 major causes of depression, anxiety, which some of include disconnection from meaningful work, disconnection from others, and disconnection from a secure and hopeful future. He emphasizes that the more of these disconnections an individual experiences, the more that they are prone to depression and anxiety. So it's the societal shift towards individualism and away from collective community-centric values that has exacerbated these disconnections. Contrary to the heavy reliance on medication, he argues for more holistic approaches, like building a more cohesive society, placing an emphasis on meaningful work, community, and true connection, basically peer support. And through this, he suggests that we can address the root causes of depression and anxiety rather than just their symptoms, and emphasizes the importance of systemic change and community building as integral to addressing the mental health crisis. That's what I have on that.
I like that. You all remember from Co-occurring, he did what was it, Rat Park? With Guyton's training, he did that video. That was Johan. Yeah. Right on.
And
Thank you.
a little bit to jump in on that as well.
Yeah.
I just found that the part of him having to, well, as he stated, he went 40,000 miles of journey so that he could continue looking for experts, like leading experts, just anything to help him with figuring out, why do I have this and why do I feel this way? And it all just kind of led to, these are the different solutions that we have, and these are the different causes of the anxiety and depression you have. which then he kind of stated these are the ones that offer real hope, which is, I felt like, is a very important kind of quote that I wanted to add in.
Oh, thank you. That was, woo, Carlos. Thank you, Janet. That was rad. All right. And drum roll. Who has 2020 SB 803, Senate Bill 803 peer certification?
I think Rudy and I are sharing it. Rudy, do you want to start? I can finish. Oh, you're muted, my friend.
Okay. What I got was, it was a bill aimed to standardize the training and peer support and certification process. It was aimed at doing that for individuals who have the lived life experience. Who have a lived experience with substance abuse or mental health program. And it was making it a benefit in Medi-Cal for people, allowing it to be paid for by the feds. Go ahead, Sheba.
Yeah, so it's a really wonderful bill. I work in public policy, so this is like my real house, and something that I'm really proud of. But yes, what Rudy kind of shared is following other, 48 states, really bringing California up to speed on how we address people who are experiencing behavioral health, making sure that we're using people with lived experiences, because those folks do get to the heart of what people really actually need. And just sort of like the misfortunate fact that we are actually, the workforce in behavioral health is declining. And the way to sort of staff up and bring people into treatment, into care, is actually having people who are peers sort of join that workforce. So the focus on education and training for people with lived experience to be Medi-Cal certified, to get those federal dollars, and get people the treatment access that they really truly deserve in this state. Very, very expensive state.
I love it. Thank you. We're the 48th state to finally jump on board. Can you believe it? Go ahead, Rudy.
No, we're good.
Oh, okay. That was fantastic. Oh my gosh. Woohoo! Did you have your hand up? Go ahead.
I just want to say a really quick, thank you, really quick fun fact, but it's a not so fun fact. And it's in regards to the lobotomy. So in 1949, there was 5,000 procedures done in the United States alone. And then by 1951, there was 20,000 procedures done of lobotomy. So I just want to throw that out there because it's pretty gnarly.
Yeah. What was the percentage in 49? I mean, what did you say? How many in 49?
5,000 procedures.
Okay.
In 49, and then in 51, 20,000.
Wow.
Yeah.
That's a trip. Thank you, everyone. Woo! Does your head feel a little bigger? All right, let's take 10 minutes. Let's come back. Anyone heard about the ugly laws? You know, we once had ugly laws. Oh yeah, I'm gonna blow your mind. We're gonna first, okay, someone wrote something really quick in the chat about the ADA being there's more to it. So I'm gonna show you a quick video on that. It's gonna blow your mind. And also I'm gonna show you a quick video on ugly laws. I kind of throw it in there because it's just like, what? Okay. But anyway, 10 minutes, we'll see you. Enjoy. Okay, wow. I love it. You see how I get excited about the history of the peer support movement. Man, in 1868, a woman, Elizabeth Packard, thrown in freaking an asylum by her husband because she didn't agree with their religious preferences there, right? She was able to make that movement, my goodness, and turned it around. 1868, and here we are, 2020, SB 803. Look at all you. Ooh, so exciting. Okay. So let's move. Now I'm going to show you a video about the ADA. I told you that's something to know about. And I love Christopher's spiel in the box here. Very important. So important. So I'm hoping everybody will be back in time to watch this. All right, cool. And then I'll go ahead and share my screen. Okay. And I'd like to see you. There you are. Okay, here we go. You can see my screen? Janet, I see you. Yeah, Carlos? Okay, cool. All right, and this is anybody, the Capitol Crawl. Anybody heard of the Capitol Crawl? Okay, check it out.
These are disabled protesters crawling up the Capitol steps to demand that Congress pass legislation to protect disabled people from discrimination. 34 years ago this week was the infamous Capitol Crawl, a critical event that led to the ADA being signed into law. The ADA, the Americans with Disabilities Act, is the most important piece of disability legislation in US history. It's basically a civil rights law that prohibits discrimination against disabled people. On March 12th, 1990, over 1,000 protesters took to the National Mall, and a lot of disabled protesters got out of their wheelchairs or set aside their crutches or walkers and physically crawled up the Capitol steps, 83 steps to the Capitol. 4 months later, the ADA was law, all because disabled people said enough. The superstar of the demonstration was Jennifer Keelan Chaffins, an 8-year-old activist with cerebral palsy.
Woo! Right? Sometimes it has to take a face with the issue to penetrate the heart. Am I right? Pretty wild, right? I mean, that took years to get that to go. It just didn't happen, right away. We talked about ugly laws. This might disturb you. All right, this might be a little disturbing. Okay, just listen to the dates again of the years. Okay, check this out. And we won't go too much into this because we could get stuck in this one for a while. But oh, whoops. All right. Is it not playing? Oh, here we go.
You know that it used to be illegal to be disabled in public? As recently as 50 years ago, cities and states across the country had ugly laws that barred disabled people from going outside. Come and take a deep dive into this scary piece of US history with me, a disabled person who is not ugly. It started in San Francisco in 1867. The first law of this kind in the country deemed it illegal for, quote, any person who is diseased, maimed, mutilated, or deformed in any way so as to be an unsightly or disgusting object to expose himself or herself to public view. The cruelty of it is hard to process. Disabled people being labeled as objects unable to exist in society because we don't look or act a certain way. Similar laws started popping up all around the country. A lot were city laws, but Pennsylvania's was for the whole state. Veterans coming home from war wounded were often targeted. These laws were also majorly geared towards poor people. They were sometimes even known as unsightly beggar ordinances. They were, shocker, racist too. In San Francisco, the people oppressed included Asian immigrants who were considered disease-ridden. And one interesting caveat to some of these laws, disabled people could be in public if it was for performance or entertainment, meaning freak shows were a lot of disabled people's only means of survival. And what a clear message that sends. Your identity is acceptable only when it's being exploited. The last of these laws were repealed around 1974, the very last being in Chicago. 1974 is so recent. To put it into context, Biden was 32 in 1974, and so was I. Retelling this history is uncomfortable but important because while these laws don't exist anymore, their impact on our culture continues to be felt. It still isn't safe to be disabled in public. In fact, a 2021 Department of Justice report found that disabled people were disproportionately victims of violent crimes in the United States. And in 2019, the rate of violent victimization against disabled people was nearly 4 times higher than for non-disabled people. The last ugly law was repealed 50 years ago. Yes, we've come a long way since then, but there's more work to be done. I hope you learned something new here.
Did I give you some more food for thought today? Isn't that wild? You see the year, this is just, I just think we're on that timeline. Keep thinking we're on that timeline, right? Anybody? I know we could go on a huge discussion, but we're going to keep going, okay? Just sit with that. Put your stuff in the chat. I'm telling you, this is... All right. So now we have guidelines. Peer support specialists now have guidelines, right? Voluntary. Peer support specialists were hopeful, open-minded, we're empathetic, respectful, facilitate change, honest and direct, mutual and reciprocal, equally shared power, strength, space, transparent, person-driven, All of those things that I've listed here, do you sense that in here in this room? That's us, man. And you know, we're here for a reason. You all are here specifically for a reason, and this is why, right? This is us. You know, before you know, those asylums, I think of you because I am a psych tech and I went to the psych nurse program. You didn't have to have license. They were having people working with these people in these asylums that were nonverbal at that. And so there was a lot of abuse. They weren't checking backgrounds on anybody working with anyone in the hospitals as well. All right, so really quick, here is what peer support, a quick video on what peer support is for families and caregivers.
A family peer support worker is someone who has lived experience with either their own family members or friends who have substance use or mental health challenges. I was introduced to some support groups for me to find out a little bit how to support my loved one. Through that, I was introduced to another family peer support worker who supported me through the process, who understood me, who felt what I was feeling, who exchanged experiences, who was very compassionate and kind, and I didn't feel alone in that whole process. So therefore, with that, I wanted to become a family peer support worker to help other people go through that in a more positive way. The journey coming through Access 24/7 with a family member is the client, the loved one who needs the support, is seen by a mental health therapist. From there, they are introduced to the family peer support worker so that we're able to sit down with them, either provide them supportive listening, advocacy as to what's going on, system navigation. We educate them on what their loved one is going through and how they will be supported through the system so that they understand and they understand how to support them. If a family member calls into our clinic here, they go through our crisis line. From there, they are passed on to connected to a family peer support worker. We do have 4 members on a rotation throughout the week, so they are able to be connected at any time. Family peer support workers also are able to see you out in the community, which works for a lot of family members instead of coming into the clinic. So we really try to meet people where they're at and make the process easy. I find that family members that we engage with are very happy and pleased that there's somebody there to understand. They open up, there's a connection that we have that you can't have with either a clinician or a doctor because we have lived experience. We're able to share that. So the bond can become really quite strong.
So that's what your role is going to be as a peer support specialist. Like you could have the role of a peer partner, a parent partner, right? If that's your role, because you can go, why integrate us now? We can go in so many different avenues with this field, right? Parents, you could go with judicial, right? We could go with the unhoused. There's going to be specializations in this later, which there are, but later on we'll focus on this. And then you could get a specialization in peer support. I think there's like 4 different categories, right? Youth, unhoused, judicial, and we could get into that later, but it's this, like I said, we're trailblazers. This is getting huge and big, and you can see, so basically what we just saw, if you're not working in the field yet, this is somehow how it's going to work out. You're going to have someone that's coming in your program, getting enrolled, they're going to meet with their people, and then they're going to introduce them to Tamika. Here's your peer support specialist. You're going to, sorry to put you on the spot, but hey, I got to meet Tamika. She looks like she's got a cool smile. All right, let's work together. What are we going to do? You know what I mean? So that's how it rolls. And that's what it's going to look like. Okay. And it's so important. So you see why it's important right now to integrate peers into the workforce after everything that we've talked about the last couple of weeks. All right. Now, we don't have our shirts made yet, Carlos. Did you get my shirt made yet? My It Depends shirt? All right. We're going to play a game today. This is everyone gets so hot and heavy about this one now. We're going to have, okay, so I have an exercise for you, and this is rad. And people are like, oh my God, what, does this need to be on the test? No, this is not going to be on the test. What you need to know for the exam on this one, basically, Olmstead Act, know about the Olmstead Act and the ADA is a big one. But basically, it depends. Remember from the beginning with Joe Ruiz? Woo! One of the OG right there, trailblazers, he told you it depends. You're going to say, what if this happens? What if this happens? It depends. So we're going to go into an exercise that's called peer roll or not. Okay. And we have 22 examples here for you. And I'll just go and grab one. Let's see, 14, send flowers on a birthday. Okay. Is that a peer roll or not? Right? Think about it and think about ethics and boundaries with Guyton. Okay, remember professional. So all this is so cool because all these competencies all going together and weave this beautiful tapestry. So all this is going to be in these questions, okay? The answers in the questions. So let's see, what do? We like to pair them up. What did we, oh, shoot, I forgot how that.
How many breakout rooms would you like? 'Cause
let me check and see.
if we do 8, Renee, there'll be 5 per room.
Okay, because I kind of like doing pairs, but
Okay, we can do that too.
let's
I can
do
recreate
pairs
them.
for 20 minutes.
You got it.
Is that too much time, you think? Maybe 15, 20 minutes? Is that too much time, Bianca, you think? You guys? Matthew,
I think.
what do you say?
Oh, Matthew. Well, I think because
I want to hear your feedback because I love, you all, I want for you too, and this is for you. So what do you think? 15 minutes, too much? Too much?
I think 15 is good. But it's because it's a
Matthew?
small question.
Fantastic. All right, Ariane.
Can I suggest breakout rooms of 4 simply because the more heads that are there, it creates
love it.
better dialogue.
Absolutely. Let's break it up, Carlos. Do the math. Thank you. Now, see, I love this. I need to hear this. I want you all to be, yes.
Yeah.
Right? So I don't have all the power. Although I could, but I don't.
All right, Renee,
right, I'm a little giddy now.
we
Okay,
have 10 breakout rooms, 15 minutes, right?
15 minutes. Okay, so you get the idea. Hash it out between the two of you. So it's have Hillary, myself, Angelina, and Ariane, I'm sorry, I'm going to get it right. So we're going to go through 1 through 22. Don't get stuck on them. Go through each one, and you're going to say peer roll or not, yes or no, and why not. Okay? And then let's just move through them. So when we come back and report, we're all going to go through it together.
Renee, where do we access this graphic while we're in a breakout room?
Okay, I will put that in. Actually, I'm going to drop that. Thank you so much. I'm going to drop it in here. It should be in your activities packet and handout, but I have it right here for you. Got it? I'm so excited about this one. All right.
We're good to go, Renee?
Yeah, good to go. Have fun. Welcome back, everyone.
My apologies for my group. I checked out a couple seconds early. We were in the middle of conversation. I hit the button. So my bad.
Later, I'm out. I got a cool report I want to share.
My bad.
Tamika, and you missed the best of the conversation, Tamika.
Oh. All right. Welcome back, everyone. We got everyone back in the house. Right on. Okay. Let's do this. All right, peer roll or not. All right, let's do this. Okay, so let's do this all together. Number 1, talk to your super about suspected child abuse, peer roll or not.
Yes.
Yes. Okay, most definitely. Okay. Number 2, offer advice about a new prescription.
No.
We're not doctors.
Hell no. I'm like, I will, don't, you work too hard for your certification. I work too hard for my license. No. Stick to your scope of practice. Take the client to community college for an orientation. Is that a peer roll?
Yes, if they're willing.
Oh yeah. Who said that?
Yes, if they're winning.
Yeah. Yes, Robin, if they're willing,
Robin.
right? Yes. Woo, Robin. Thank you, Robin. Absolutely. Develop a trusting relationship through going to a coffee shop together. Peer roll or not?
Yes, if they're willing.
It depends.
Depends on the facility.
It depends where you're working. Heck yeah, I took people to coffee shops all the time. That's how I built rapport and gained trust. Oh yeah. So there's my depends shirt. It depends, because it also depends on where you're working, if they allow that or not. Professional boundaries and rules, ethics, right? Getting comfortable or not? Is it that you can't, or are you not comfortable going to a coffee shop with someone?
So can I ask you a question?
Please do.
So if it depends, how would you answer that?
Oh, okay. Well, answer that to
Yes or no?
like it depends. It depends on the situation. It depends on
Our facility
if-
doesn't allow it.
Thank you. So where you're working, Shawnee, let's say you're working with Carlos at Project Return, right? And I'm working with Mental Health America, California. You're hanging out with Carlos, and they can do that, right? But with me, we can't because of my policy.
Hey, can I ask you a question though?
Yes,
Wait, just a second, because I'm so if that's a test, and if it's a yes or no answer.
Oh, this is
how
not
would
going to
you
be on.
act?
Are you talking about like on the exam? This is not. I explain. Let me go back and clarify. Yeah, this is not going to be on the exam. Okay, no. I want you to focus on the history. This is just saying, hey, it depends. We're throwing everything together from ethics and boundaries. Are you comfortable? Are you not? Right? Yeah. Thank you so much, Yolanda. Hi there.
Hi, Renee. Good morning. No, Shawnee just asked the question. That 120 test. That was my question.
Oh, yeah. Yeah. No.
Is that question on the test? And
Oh,
is
no. Not on the test. So that just want to make that clear. We're not looking. This is just peer role or not. It depends, right? You get it? Okay, cool. Don't want to confuse. Talon.
No, I was just lowering my
Oh,
hand.
okay. I'm sorry. Is it Talene? I keep forgetting. I'm sorry. My ADD is Talene. Okay.
It's taught lean, like
lean. Like lean into it, baby.
Yeah, just lean into it.
So when we're, I
Go
just
ahead.
have one more quick question,
Yes,
Renee. So when we're
absolutely.
at the coffee shop, are we allowed to pay for the pure food or coffee?
Oh, that's another. It depends. Okay. It depends on what your team is. Okay. For instance, I was on an outreach team. We had petty cash to be able to make that engagement and buy that coffee, right? We were able to go as long we went to McDonald's. Hey, you get the dollar menu, you get you know what I mean? Like that you had petty cash, but that's because we were an outreach team and we had that allotted to be able to do that, right? Otherwise, if I was another like a say, for instance, they're getting GR or Social Security. I don't pay for. They have money, they could pay. Let's go to the coffee shop. We're teaching them, also coaching them how to pay for their own stuff. Does that make sense? Cool.
Got it. So hopefully, if it's on the test, it's going to be based upon the agency that you're working for.
No. Trust me, we'll prepare you for those state exam questions. That ain't going to be. We won't steer you wrong like that. No, not at all. Okay. Let's keep going. Have an in-depth discussion with the person about their history of child abuse, peer role or not.
I have a question about that.
Okay, Desiree.
So I was talking to my group, and my role here as a peer, I'm a bridge to therapy. So let's say if they're not able to see their clinician because they're so booked out, I am able to provide active listening and emotional support as long as they bring up the subject.
Oh yeah. So it depends right there, right? Some people, hey, you can, right? But also listen to this in depth. I know that'll throw you off with that in-depth part, but like we were doing self-disclosure. If someone says Shawnee and Shiva, or we're all talking and Shawnee's like pouring her heart out to Shiva and I and talking about her history of child abuse, we ain't going to go, stop right there. We can't, I'm not, that's not my scope of practice. Like, we don't want to shut them down like that. We listen to a point, get in there and go, hey, thank you so much for sharing that with me. That's got to be scary, blah, 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 whatever. We have amazing clinician on the team and she's really an expert in that area. I would love for you to meet her. I'd go with you if you'd like, because I know her and she's really cool. Does that make sense? So it depends. You see how we're just trying to kind of show you we got to learn how to pivot and move in this role. Again, it depends on where you're going to work, right? Where you're at.
Question on that one also.
Yes.
Like if your expertise is in childhood trauma, I feel like you could have more of a conversation and support them with like tools to use and stuff like that. Okay.
And yes, and that depends on your relationship with them too, as well. But always, always, always fall back on your team, please. Okay. Because I know we have our teams and we'll have case consultations. Always talk to your team. Okay. just to make sure. Yes, Hannah.
I just wanted to give some unsolicited
No,
advice
please, I
really
love it.
quickly.
Give it.
So, I am recertifying. I was certified in Texas and I've worked as a recovery coach for several years. But I worked with a client who, long story short, just had a massive crash out because another recovery coach encouraged them to make this exploration of their trauma without any kind of like clinical oversight. And the family of that client ended up suing, and that person lost their license and had to pay a bunch of fines, and that person's never going to work with any kind of licensure ever again. So while it is a gray area, you better be able to like turn around and justify what you did and what you said and why you did those things. Because if for whatever reason it leads to something,
Absolutely.
then you will be asked very directly and with a government, by a government. So
absolutely. Thank you for that. And then I'm going to go into documentation on Monday, as I'll do like in documentation, but thank you for that. Yes. Yolanda.
Thank you, Renee, for going into that documentation. That's one of my concerns too, is the legal.
Oh yes.
The legal,
Oh,
because
yes.
we have, once
Absolutely.
we become peer certified, we have that number next to our name. So it's like, do we need to take out malpractice insurance? No, my
Yes.
colleagues, my colleagues at LA County Department of Mental Health, they tell me horror stories.
Oh yeah.
Horror stories. And they've said also the things that some of the consumers and clients say on their Instagram, like slandering and defamation of character of even their reputations. So that's why it's so important to pick your population.
Absolutely. And you know what? Now that they're bringing Carlos, I'm thinking of this social media. Like I can't imagine now. Like, oh, okay, let's not even go there. But yes, always, fall on your team, your policy procedures, trump everything. Okay. Let's go. Teach effective communication skills, peer role or not.
Peer.
Yes. Provide support to a parent in a crisis, peer role or not. Yes. No. Right. It depends, right? Where you're at. Who said no?
I said no.
Communication skills.
The only reason I say no is because that's not the member.
Provide support.
Exactly. If you're like, unless you're with the parent primary and you have that ROI, right? Release of it. So yes, it goes deeper into other stuff. All right.
Which question was that? Sorry, I missed it. Which question?
That's okay. That was teach effective, or no, hold on. To provide support to a parent in a crisis, number 7. Okay. Yes, a sticky situation. So it depends. Identify a problem as a side effect.
This is the problem.
No.
Right?
I want to tell you why it's a problem, right?
Please tell me. Please tell us.
And I think it's the way that it's worded that's the problem. Because the side effect is the one that's like throwing you off, right? Like, okay, no, I don't want to deal with that. But then the other part of it is the identify, right? So if someone's standing in my office and I'm looking at them sweating profusely and like, just like they look like they're about to pass out, I can identify there's a problem. So I could refer them to a doctor. So I feel like it's a toss-up, a total toss-up.
You see? Yep. It depends. Where's our shirts? No, but I love, you know what? Thank you for that, because no one's ever pulled that. I've never seen that piece in that. So thank you for that.
It was actually Yolanda who really brought it
to. Yolanda.
Well, I know from experience that if that person leaves your office or you're the last person to see them and they go into a diabetic coma and pass away, you were the last person to see them. So if I see something, I got to observe it and tell a psychiatrist and easily get a doctor. It could be withdrawals. It could be any, if we see anything, we got to side effect. Side effect is what made me, diabetes is one too, because diabetes can look like a withdrawal, but it's not. And they can go into a coma.
Sorry, I got this.
And again, that's on my certification. That's on my number.
I got you.
So now everyone's going to come visit Yolanda.
So you get the main idea though, right? It depends. You go fall back on your team, always ask, talk to your team, know what your scope of practice is, okay? Help someone develop a RAP plan.
Here.
Yes, we did that safety and crisis yesterday with Helen. Determine that a diagnosis is inaccurate.
No.
No.
No, okay. Refer a person to a food bank.
Here.
Yes.
Yes, accompany a person to a doctor's office.
Yes.
Yes, if they want you to, right? Like someone said in that, Robin, right? If they want you
willing.
to. Yeah, if they're willing to. Provide psychological testing.
Nope.
No.
Ooh, right. Send flowers on a birthday.
Nope.
No. Boundaries.
What if we sent it from all of us, the team?
Yes.
Yeah, it depends. Yeah, it depends.
Yeah, it depends. You see, right? Okay.
You
could
got
get
bound.
Yeah, right.
You have boundaries.
I love it. Yeah, well, Robin, listen, Carlos. I know you want to send him the thing, but let's all sign it for you. No, it's just boundaries, please. Lend money for an emergency bill.
No.
No.
Don't
Depends.
money. Hey, depends. Okay. Ooh, Carlos and then Ruth.
Well, because we talked about how some facilities have the capability to be able to pay or provide services or refer them to services. So no, you can't lend them the money yourself, but you can basically, and also depends what we talked about last time, if they're brand new in the program or they've been in for several months. Like, well, you should have thought about this prior. You've been trained. You have done all the work, and someone that's brand new might not know what's available to them.
Absolutely.
So it all depends on where you work at.
Yes.
Absolutely, because they also spoke on some clients they was allowing to make money by washing cars.
Oh, right. That was on the vignettes. Yes, Ruth.
Basically, Carlos covered it. I was just thinking, if there's some fund at the agency work for, and we do that, then.
Right on.
Yeah.
So we would do that. Yes. So when they, whoever was enrolled in our program, they needed money for the electricity bill. It was like, okay, we're going to lend you this money. You sign here. You're going to pay us back. Right.
But we have to remember that most of these questions are directed to the person, not the agency. That's why it has to be. That's where you have to draw the line or make the distinction. I mean.
Yes. For the agency, for the person, right? But then always fall back on your agency or what your policy is.
I mean, you can always give them a resource for utilities.
Exactly, right. And there's all kinds of different resources, and that's where you're like, oh, this place will pay your electricity bill or give you a big discount. Very cool. Offer advice on herbal remedies.
No.
Okay. Let's see. Tell the unabridged version of your life.
No.
Okay. Make plans to go to a ball game.
Yes.
No.
If you're willing.
It depends. Yoo-hoo. Yes. Have a deep conversation about unresolved issues that go beyond supportive counseling.
No.
But if they're talking to you about and they're in the middle of it, you're not going to stop them, but you're going to kind of go in there and go, oh yeah. Okay. Perfect. Yes.
And I would say it depends on your expertise again, like your personal focus, right? Because
on what your title is, right? Compared to what your title is.
Well, I guess my question, I have 20 years of experience in research into trauma.
That's right. You do have that specialization.
You know what I mean?
And then again, that goes back to your team. And if you were to talk to your team on debriefing or whatever, am I able to talk about this stuff? You know what I mean? Just run it by the team, make sure that you're can I do this? Am I certified? Just know what your role is for sure and bounce off your team.
Can I make a comment really quickly?
Please do.
And I'm just speaking because of I have a lot of different people that work in my company, and we have psychiatrists, we have therapists, we have all sorts of people, counselors, and it's really important that they only do it's one of our policies and procedures that they only do what they're certified to do, because if they do anything outside of their certification, we can get sued for it. So you just got to be really careful with stuff like that. I really try to keep my mouth shut, because I personally, I'm like, I know everything about drugs and alcohol, but I really try to keep my mouth shut, because sometimes I want to be like, I know what that is. And I want to act like a doctor, and I'm like, just shut up. I can't talk right now.
Oh, awesome. Yeah, no. Thank you for that. I appreciate that. Oh, I love this. Provide family therapy. Again, scope of practice. No, not for a peer. Explore the impact of painful childhood memories. Not your rule, right? But if they start, you refer them to someone. Explore and advise the client to change your dosage of medication.
No.
No.
Never.
Right on. Okay, so everyone good on this? Are we all good? Anybody leaving confused?
I have a question, Renee. I know some people are saying, you have to have some kind of credentials or something, but when does your lived experience come into play with these kind of topics?
Oh, that's when you're like, okay, so when you're teaching effective communication skills, let's say you're helping someone to develop a RAP plan, you're going through the RAP plan, you're sharing with them whatever it is your experience was, or sharing how you did it, taking them to a new community college. You could also, you're talking to them while you're doing these activities. So whatever it is, their goal that you're working on as well, you could do that whole motivational interview, and you could do that whole reflective listening or coaching along as you're doing it with your lived experience, along with them, whatever it is that you're working on with them. Does that make sense? Mm-hmm. Kurt.
Yeah, I definitely overthought this with words like explore, in-depth, deep conversation, but it really is important to be on the same page as the place you're working with, is what it seems like it comes down to.
Absolutely. Yeah, it's the culture where you're working at. Yeah. All right, Ruth.
I guess maybe that answers my question. I'm just going back to lived experience, and my lived experience is childhood trauma and recovery in that scope or whatever, in that realm.
Yeah.
So
and I know this is probably, it depends on where you're going to work. We're just kind of going through what our role would be, but I know like you could take this and you'll get specializations and everything, but just for the most general part, is this your role or not? We just want to know what our role is in scope of practice and make sure you're aware of what your job role is for sure. Okay. And your policies and procedures. Shanae.
Please go back over number 6, please.
Number 6, teach effective communication skills. Right? Yeah, that's role modeling, role play. We go to the doctor. Okay. Hannah and I we're gonna role play this. What's it gonna, okay, we're gonna go in there, we're gonna see Desiree at the receptionist desk. How are we gonna approach this? Okay, like, just make a plan. All right, thank you. So what we say matters. You can still see my screen, right? We good? All right. Can I have someone read? Here's a little poem. It's called A Person and a Patient. All right. Get a reader?
A person gets excited when a patient is manic. A person has concerns, but the patient is in panic. A person is expressive. A patient is histrionic. A person can get better, while a patient is often chronic. A person may get angry. A patient becomes agitated. A person is creative thinker. Patient's thoughts are not related. A person may be sad. A patient is depressed. Depressed, where are we? A person may be childlike. A patient is regress. A person may be cautious. With the patient, it is guarded. A person may change her mind. A patient must finish what she started. A person might try to influence. A patient manipulates. A person gets a second opinion. A patient triangulates. A person is an activist. A patient is antisocial. A person is a visionary. A patient is delusional. A person lives in a home. A patient is in a facility.
Sorry. My apologies.
Facility. A person is much strength. A patient has a disability.
Awesome. Thank you so much. So you see that, I have friends that are doctors, and like, if I go see a new doctor and they're friends with that doctor and they know that they know me, they treat you totally different. You notice that? So this is what makes me think of that. It's like, oh man, if they didn't know that I was your doctor's friend, they wouldn't. Okay, quiz time. Woo-hoo-hoo! All right. A consumer tells a peer support specialist that their Social Security disability insurance application has been denied due to an error on the psychiatrist's form. the consumer's upset and asks the peer support specialist to fix it. How should the peer support specialist respond? A, let the consumer know that the peer support specialist can look into the consumer's chart and get the correct information and resubmit the form for them. B, tell the consumer that the peer support specialist will file a grievance to the Social Security Administration on the consumer's behalf. C, ask the consumer why they think they are disabled if the Social Security Administration disagrees. Or D, remind the consumer that the form must be filled out by their physician and offer to help them practice on how to approach the physician if necessary. Remember those 4 components. PICS, right? Is it person-centered? Is it inclusive? Is it, hold on, here we go.
It depends.
That. Oh, it's funny. Was that you, Bianca? D. Do we see that? Hold on. Do we need to go back? Obviously, right? Recovery support, the KSA dimension 4. Understand the difference between the role of a peer support worker and a clinical provider in the individual's care. So we talked about that scope of practice, right? If that's that whole peer role activity or not. And thank you. You all got this.